What's up, my beauties? How are you guys doing? Here is your ever smiling Chi as always. I hope my mic is giving what's supposed to be giving because I can't talk well. If you hear me, I am a bit under the weather. Yes, my nose is blocked completely, and yeah, I am not feeling so good. This weather has been giving me double shit together, if you know what I mean. But yeah, I miss you guys. I didn't upload last week because, like I said, I have been a little bit under the weather. This is absolutely the best of my weather. The best weather. The best season, sorry. Yeah, it's my best season, if you know what I mean by that. Okay, just like I said, if you do not hear what I say very well, if you're not hearing me well, just know, just pardon, okay? Just bear with me. Yeah, I am here today to give you an advice, sort of. By the way, two of my subscribers are in Germany, and I didn't know until last week. They are in Germany to do nursing, not to work as nurses. Two of them. Shout out to Laura, shout out Ego. Yes, they came in. One of them came in 5 months ago. Decided not to talk about anything. The other one just came in 3 months ago. Okay, two of them are here to work as nurses, and every of their plan went out fine. Okay, and I'm just here to, because I talk based on what people ask for. Okay, I don't like, I do it sometimes to just do random videos, but I like checking out what you guys want me to do. Okay, so always, if I hope is always what you want to watch, but if it is not for you, say hi, watch anyways, and like. Okay, but like I said, I normally go out with what my audience want me to talk about. Like today I just want to give brief advice concerning nurses here, working as a new nurse, because I have two people that just came into the country and they want to work as nurses. I want to, and generally, if I know you, if I don't know you, or if you don't want to talk yet that you are here, or wherever you may be, it must not be in Germany, anywhere you are. If you just left if you left your country to another country to work as a nurse, this this advice will help you a whole lot. Okay, let's start. The first advice is for you to be open. Okay, if you're a nurse here, if you're a new nurse, you did not know anything, you just started, maybe you finished your education, you just started out. Just try as much as possible to be a team player. Be nice, be very nice to everybody, to your superiors, to your team, to the patients. Be very nice, be open. It helps a great deal. It helps. Just be open, accept everybody, and be a team player. Always be there to help others. Okay? People cherish it so much. Like what people team what people call team players, for instance, if you just finished working, doing your own part of the work for the day, and it is break time, for instance, just try and see what others are doing, how far they are, okay, how far they have gone. Just ask them, hi, what are you doing? Have you finished? Do you need help? Okay, not just go into just say it's my break time, let me just go somewhere. I will just get into break room and do and observe my break. Just ask others, okay, for that, you know, team's sake. Just ask others. People cherish it a whole lot. Then another thing, very importantly, if you are a beginner, a fresher, try keeping journals. Pocket book. Just get yourself a pocket book. Keep journals. Let it accompany you wherever you go to. Okay? If you are in any patient's room, if you have it, if you need to do something, the things that you do for the day, there is every possibility that you don't finish what you tend to do for that day. Okay, jot down things you've done, jot down things you've not done. The ones you can carry them over to the next day. The ones you can't carry over, you give it over to the next shift. Okay, but just write everything down. Things you are learning new, just be writing them down. It helps a whole lot. I can't imagine somebody just walking blindly, new nurse walking blind without jotting down something. You have to jot down something. You just need it. I see some people writing on their skin. That's not good. Get something. Just look smart. Get something. Write down things. Write down. For instance, if you measure blood pressure, you need to write them down. Just write down things. Like I said, things you achieved for the day. Write them down. Things you didn't achieve, just give it over, or tomorrow you continue. That way, it gives you, it makes everything clear for you. Okay, it gives you that what is it called? You just feel, I am well coordinated. Okay, it makes you feel well coordinated ahead. This is what I want to do today, and have a plan for each day. Okay, aside your job, aside what what you have to do, just have a plan. Okay, today I don't know this, I need to do this, let me do this. Just write them down, things you also want to learn, because as a new nurse you just started learning. Okay, school is gone, but you just started learning. Your experience starts counting. Okay, so just be jotting everything down. Another thing is, ask for feedback. Yeah, ask others for feedback, especially your superiors or your preceptor. Somebody, they must have assigned somebody to help you or to teach you, okay, to show you certain things. Ask them how you are moving. It's always good, okay? It's always good, because you will know, I'm getting this right, or I'm not getting this right. So ask them how you are moving. And it's also something like receipt for you. How do I, is it receipt in English or what? It's something like a proof, okay? If you ask your superiors, and if they say you are okay, should they in future say that you're not okay, you call them back. You then tell them, maybe I asked you people and you guys said I am doing fine. How come you are guys telling me this now? Okay, so it's always good to ask for a feedback to know where you can better yourself, your where you can better, and where you are good. Okay, it gives you also this thing, assurance. Okay, I am doing good here, or I'm not doing good, I need to pace up. Okay, so it's always good to ask for a feedback. Okay, then another thing is, every new nurse has a checklist, a skill checklist. Your skill checklist, in your skill checklist, you see everything you need to learn, everything you need to know at some point, at each given time. Okay, so make sure that this book accompanies you too. Don't keep it at home, no. take it along with you. Anything you do, normally they'll say you did. They show you this once. They show you this second time, and then you did it alone, something like that. Okay, so anytime you do something alone, just mark it, or maybe with signature or with marking. Just make sure you are on this book. Make sure you mark everything. Your superior or your preceptor, anybody that's showing you anything, make sure the person signs as well. It's your proof. It's your proof. You don't keep it and you don't give it to anybody to take over. No. Normally, sometimes the colleagues say, "Give me at home. I will mark, or I will sign what I taught you." No. Make sure you are there with that person and you are signing what you are really being taught. Okay? Because at some point they will it's assumed that you should know certain things. And if you do not know, for instance, after a year, you should know certain things. And if you do not know that, then there's a hitch, there's a problem. So make sure you sign what you're being taught. And things they do not teach you, make sure you follow them back to back. Your superior or whoever is teaching you, make sure you follow them back to make sure they teach you that, because there will be a time there will be no time and everybody will be seeing you. You should know this thing. Then they'll be thinking you were daft for not knowing that. Whereas they do not know, nobody taught you that. Okay? So you have to follow them back to back with your book. And if you notice that nobody has time for you, the person assigned to you does not have time for you, then follow it up with email. That's another proof. If you follow it up with email, that person even knows, okay, you have a proof. Right, please, when are you showing me this? You promised to show me this. Please show me this in a friendly manner. If that doesn't happen, you have a proof. In the future, you will call them back and say, I tried, even writing an email. So be wise, very wise. Be wise as the serpent. Make sure you do things accordingly, because it is your future. It is your dream. Your job is your dream. Your job is your future. Okay? Then, another thing is also, while being good, also stand for yourself. Do not let anybody shake you. I'm saying this, I'm telling you guys, you, my new nurses here in Germany. Imagine you coming from another continent. You have to show yourself that you are very good before you were accepted. There is mobbing everywhere. So, you have to advocate for yourself. You have to stand for yourself. Don't let anybody down talk you. Don't let anybody push you around. Take you for granted because you are good or whatever. Okay? Try be good, try be kind. But stand for yourself. Anybody that once says, hey, you're not doing something right, say, please tell me I'm not doing it right. Or teach me the way. Okay? Be very specific with your words. Do not insult. Okay? Be formal. Please don't do this with me. Any person tries anything stupid, do not do this with me, please. And if that person continues, or if somebody keeps bullying you, down talking you, trying to press you down because you are new, trying to mob you, then play the defensive. That's always, I told you this, I've taught a lot of people this and it has helped many. Play the defensive. If you notice somebody is really bugging your life, go report that person. You see that person will just be hiding his or her head. Report that person. Say, this person is doing this to me. I don't know what I've done to this person. Come out, report the person first. Don't let that person report you first. Play the offensive. Sorry. Then the person will start playing the defensive, start defending him or herself. Put that person on the run so the person will start defending himself. Okay? You know, I don't need to tell you one of the things to do to hack that person, to talk, to pipe the person low. You can say the person doesn't like me. Yeah, the person is a racist. You can even go as far as making that person also miserable. Yes, do not, do not let anybody down talk you. Don't do that. Don't do that. Don't even do that. Mm-mm. Be nice, but be wise.